girl, you stay in your phone.
I know, girl. It's my boyfriend. He be having me dying laughing, girl. Oh my god.
It better be that funny.
It's doing. He be sending me his little. Y'all doing that?
Yes, y'all. You better let your grandma find out.
I know.
I'm gonna tell you.
Somebody's gonna go crazy.
When you get pregnant,
Oh, plus not. I'm from a second. I bring my baby to his house.
you better get you some birth control.
You know what? Let me call my doctor right now and make the appointment.
Hi, good afternoon. My name is Brittany. I'm going to be your nurse practitioner today. What brings you by the clinic?
I just recently began being sexually active. I wanted to know my options for birth control.
Birth control. Well, we actually have a few birth control options available. We have the NuvaRing. We have, of course, the pills, birth control pills.
That's not gonna work.
Not for you. There's the patch as well.
It might be too itchy.
Might be too itchy. Well, you know what? There's actually the Depo shot. Have you heard about that?
No.
Okay, well, what it is, it's exactly what it sounds like. It's a shot. It keeps you from getting pregnant. Hence,
Thank God.
once you get it, your birth control is covered for a full 3 months. So that's good for you, being that you said you forget, to take your pills. This one you don't have to worry about remembering to take, because once you get the shot, it's in your system for full 3 months, and there's nothing else you have to do. So you might hear the term Depo or Depo-Provera. They're both the same, but I do want you to know that along with Depo, there are a few side effects. It does affect your hormones. So
I'm gonna be crazy.
well, you might not be crazy, but it might affect your appetite. You might either see your appetite increase or decrease. You may become a little, so you might put on a few pounds there.
Can I lose?
Or lose.
weight?
Everyone's
lose
different.
weight.
Everyone's
Okay.
different. So look at me. I've been taking it for a few years, so.
I need to be small like you.
Right. Now, also, you might have a bit of bleeding the first time you take the Depo. That's one of the side effects.
So will I still have my period, or?
That is one of the side effects with the Depo-Provera. It can actually shorten your period, or it can lengthen it as well. During the beginning stages of the Depo, you might see bleeding for even up to 6 weeks, bleeding or spotting. That is normal, so you shouldn't be alarmed. But if we do have something that we can give you to stop the bleeding.
Okay.
If that becomes an issue for you.
Sounds like
Sounds like
something I'll be interested in.
Okay, and we can go ahead and administer the shot for you today, but what we need to do is take a pregnancy test to make sure everything's okay, make sure
No
you're not
problem.
pregnant. Okay, we're going to go ahead and do that.
Okay.
Okay, so I got the results of your pregnancy test. It is negative, you're not pregnant. So I can go ahead and administer the
I
Depo.
know I would have told my grandma that.
We can administer the Depo for you today. Before I do so, do you have any questions for me?
Yes. Earlier I noticed you mentioned about hormones. Exactly what about hormones with the Depo?
Well, with the Depo shot, the only hormone that it contains is progesterone. Now, that is a hormone that we carry ourselves, but this shot is, we're using the progesterone as the contraceptive.
Okay. So it's just giving me more, basically, of the hormone.
Right. You're going
Okay.
to have more added progesterone. So that's why your hormones might be a little bit unbalanced.
Okay, no problem.
Go ahead and don gloves. Move your jacket. Thank you. And just pull your sleeve up just a bit. And it is an intramuscular injection. So I'm going to go ahead and I'm going to give you the shot right here in your deltoid. In the area first. My alcohol. I'm going to feel just a little sticky here. 1, 2, 3. Okay. Good job. Thank you. Just apply a little bit of pressure. Okay.
So it works right away.
Just to be safe, wait about a week, give it a few days, just to make sure it's fully in your system. Now, I do want you to know, yes, it is a contraceptive, but with Depo-Provera, it does not protect you from sexually transmitted diseases. So, of course, you and your partner do need to get tested regularly, or try to incorporate condoms as well.
Okay. Thank you so
You're
much.
very much welcome, and do remember to be back here within the next 3 months. Because, of course, with Depo, once again, it is a shot that it's injected every 3 months.
Okay.
So I'm going to give you here a calendar. so that way you know when to return back to the clinic for your next
Thank you.
shot. And I also have a pamphlet for you so you can read up about Depo once you get home as well.
Thank you so much.
Okay, and if you have any questions, don't be afraid to call me.
I will.
Okay.
Thank you.
All right, you have a great day.
You too.
The doctor's gonna tell us what's wrong. You're gonna have a baby.
Mommy.
Okay, so how you doing, Miss Cha-Cha?
Not good.
So what brings you in today?
Just give her a moment. Just give her a moment. It's gonna be okay.
I've been trying to have a baby, me and my boyfriend, for the past 5 years now.
All right.
I thought it was him. We went and got him tested and everything. He's perfectly fine. There's nothing wrong with him. So now I'm here to see what I can do to help have the baby.
Okay, so how long you guys been trying for again?
About 5 years.
5 years. All right, so and you tested him today. Have you been on any kind of birth controls or anything?
Since I was 18, I was on the Depo shot. And I stopped that so that we can try to have, make the baby. But I don't know what's been going
So
on.
this whole time you've been on a double shot. When did you stop it?
I stopped it at about 25.
Okay. All right. So have you been to any other fertility clinics, or is this your
No,
first
this
time?
is the first one.
Okay. Have you considered doing an in vitro fertilization or any other fertility drugs? Have you considered that? Okay, so we're going to do some testing to see what's going on with you, okay? All right. Oh, wow. All right. Okay, Cha-Cha.
Hi.
How you doing today?
Okay.
All right, so I have your test results. Now, unfortunately, you're not ovulating normally. All right. Now there are, a few drugs that you can take for this particular problem. We have Clomid, we have Femira. There's also letrozole. You can do the injectable gonadotropin. There's also the bromocriptine. So I'm going to prescribe to you the Clomid. This drug has been used for over 40 years, so it does really work really good. What it's going to do is cause the hypothalamus and the pituitary glands located in your brain to release hormones. Now, with the hormones, they're going to trigger your ovaries to make eggs. Okay?
Okay.
Now, I want to prescribe you with a starting dosage of 50 milligrams.
Okay.
Around for 5 days. Okay? You'll take the first pill on the 3rd, 4th, or either the 5th day. We're going to figure all of that out.
Okay.
All right? Of your period. The start of your period. So we'll do that. You can expect ovulation at about the 7th day after.
Okay.
Now, sometimes it doesn't work, but in most cases it do. If not, I'll increase your dosage. All right?
Okay.
Now, after you start ovulating, I guess no longer than 6 months later, we should start seeing, some results.
That soon?
I assume.
That'll be
Okay.
great, doctor.
We'll
That'll be
hope so.
great. I want our kids to grow up together.
Yeah.
We're friends. We've been friends for a while
I
now,
hope so.
Now,
Thank you for being here with me
no
today.
problem. Anything for my friend.
okay, now of course there are some side effects. They may be hot flashes, blurred vision, nausea, bloating,
Ooh.
and sometimes headaches.
Okay.
We'll hope that they don't happen. Okay, they're mild.
Something
It's
to
not
look out
nothing
for.
major. Just make sure you keep an eye out for it. Okay.
Okay.
So now I'm going to send your prescription over to the pharmacy of your choice.
No
Okay. And we'll get you started.
Okay, I'm
So
excited.
nice meeting you, Cha-Cha.
Thank you very
Yes,
much,
I'll-
doctor. I really hope this works. My friend, they've been really trying.
Yeah. Well, I'll see you soon.
Thank
So
you,
I
Doc.
hope for the best.
No
Thank
problem.
you.
Thank you so
today? What is your name?
Cha-cha.
Cha-Cha. Is it okay if I call you Cha-Cha?
Yes, whatever.
Can I look at your ID bracelet?
Take the shit. Take it.
Oh, okay. Cha-Cha. Okay.
Oh,
All right, Cha-Cha, can you tell me the reason why you're here today?
I'm pregnant.
You pregnant. Okay, how far do you believe that you are?
I'm 27 weeks today.
And what kind of problems have you been having?
Contractions, they 15 minutes apart. Nausea, I keep throwing up. My back hurt.
Mm-hmm. And I checked your chart, honey. Your blood pressure is elevated. It's 152 over 90.
Oh, Jesus.
What I'm going to ask you to do now, if you could please lie back in the bed so I can try to assess your
But my back gonna hurt more.
I understand that. I will be quick about it. If you can, just please go ahead and lay back in the bed. Take off your shoes. Uh-oh. Don't film the lady's integrity. Let me feel your abdomen here.
Where's my baby daddy that no
Have
good?
you been having any leaking?
No.
Just pain?
No, just pain.
Okay, and according to what I'm seeing now, it looks like your contractions are now 10 minutes apart. So I would say that is not Braxton Hicks contractions. So let me talk with the doctor, and I'll be right back.
Call my baby daddy while you out.
Excuse me, Dr. Glenn.
Yes.
All right. I want to give you a report on the patient that we have in room 3.
Okay, so what's going on?
All right, right now we have an African-American female. She's 32 years old. She's 27 weeks pregnant. She said at home that she was having lower back pains, nausea and vomiting, cramping in the lower area. At that time, her contractions seems to be 15 minutes apart. Upon assessment, when I checked her, she told me, I checked and her contractions have increased now. They're about 10 minutes apart. Doesn't seem to be Braxton Hicks at this present time.
Yeah.
Just she has no fluid leaking. Her blood pressure is now 152 over 90. I repositioned her. We tried to walk her a little bit, and the pain is still not going away.
How long have the contractions been going on for?
The contraction started yesterday.
Okay.
So she came in early this morning. So I mean, maybe about 5-6 hours now she's been contracting.
Okay, so it sounds to me that she's going into preterm labor.
Okay.
So I want you to get her IVs flowing.
Okay.
I'm going to give you something to prescribe her so that way we can stop the preterm labor.
Okay.
But for now, I want you to transfer her over to labor and delivery so we can get that under control.
Thank
Okay?
you, doctor. Appreciate it.
Oh.
Hello, Miss Chacha. Hi, it's Monique again. I'm back. I just finished talking with Dr. Glenn, and she believes that you're in preterm labor. She has some doctor orders for you. I'm going to just go over the medications with you right now. She's ordered the indomycin, and she's ordered infilipine. I'm sorry, that's going to help stop the contractions because we do not want you going into labor now. The fetus is too young. We're also going to run an IV for you with some magnesium sulfate.
Okay.
And that is going to prevent any like birth defects just in case you should happen to have this baby.
Okay.
We don't want the baby to have any defects. We're going to give you antibiotics. Make sure you don't have any infections for you and the baby. And last, we're going to give you allergies. Dexamycin. This medication is going to help to mature the baby's lungs just in case you should happen to have the baby early.
Okay.
The only thing I want you to do right now is to relax. We're going to put you on bed rest. We got you hydrating with some IV fluids. Right now we're going to have you on MPO, okay? And we're going to monitor you for the next 48 hours, okay?
Did you call my baby daddy?
You'll have the time to call him in a few moments.
But did you call him?
Not as yet. I will. What we're going to have to do, though, is admit you. You're going to have to go to labor and delivery. They're going to monitor you at least for 48 hours to see the progress of the baby or if we can get this pregnancy stopped.
Okay.
All right?
Okay.
I'll be back in 30 minutes to assess you again.
Okay, so today we saw the different phases that Cha-Cha went through. We saw her start off as a teenage girl to get contraceptive. She started off with the Depo shot. Then, after several years of taking the Depo, she became infertile. She was trying to have a baby after a few years, and she wanted to know what was wrong. She went to the fertility clinic, and she was prescribed Clomid. Clomid is a drug that helps women ovulate. 60 to 80% of women who take Clomid, they will eventually ovulate, but only half will get pregnant. Luckily for Cha-Cha, she was one of those women who was able to be pregnant. Although she went into preterm labor at 27 weeks, she was prescribed indomethacin. Indomethacin is an NSAID, and it's a type of tocolytic that is used to stop preterm labor and to stop contractions.
Y'all go over. Hello. We gonna see you, Doc. We gonna see you. I know y'all gonna see me because we gonna see you, but. All right, y'all ready?
Our group did women's health drugs. I am Clarita Benjamin, and I was Cha-Cha, your patient for the day.
I'm Brittany Ronan, and I was Cha-Cha's nurse practitioner and best friend Ashley.
Hi, my name is Vanessa Glenn. I was Dr. Glenn. I was Cha-Cha's fertility doctor.
And hello, my name is Monique Chandler, and I was Cha-Cha's RN at the emergency department.
She's on some.
I'm trying not to laugh. She sounds so